Hello, I'm Carl Johnson with HIPAA Certify, and today I want to talk about something I see far too often when reviewing healthcare organizations, private practices, and even small clinics. Staff are using free email accounts like Gmail, Hotmail, Yahoo, or personal Outlook addresses to communicate with patients or store patient information. And I want to be very clear. This is not just a bad practice. It can be a serious compliance violation that exposes your organization to regulatory penalties, breach notifications, lawsuits, and reputational damage. Let's break this down into plain terms. When you send or store patient information, you are handling protected health information, also known as PHI. That means you are subject to federal privacy and security requirements. These rules do not care whether your organization is large or small. If you handle PHI, you must protect it. Free email services are designed for consumers, not regulated healthcare environments. They are not automatically configured for healthcare compliance. They are not configured for audit logging aligned to regulatory expectations. And most importantly, they are not automatically under a legally binding agreement that allows you to use them for patient data. That agreement is called a Business Associate Agreement, or also known as a BAA. A BAA is not optional. It is required anytime a vendor can access, transmit, or store protected health information on your behalf. If an email provider stores patient data in their system, even temporarily, they are considered a business associate, and without a signed BAA, you are disclosing patient data to a third party without authorization. That alone can trigger enforcement action. Federal regulators have issued monetary penalties ranging from tens of thousands to millions of dollars depending on severity, duration, and negligence involved. These penalties often increase when organizations fail to perform due diligence on vendors or fail to put proper agreements in place. Now, let's talk about flow-down risk, because this is where many organizations get caught off guard. You may think, Carl, we don't use Gmail. Our vendor does. That does not remove your responsibility. If your billing company, scheduling service, transcription provider, virtual assistant, or contractor is using a free email account to handle your patient information, that risk flows back to you. Regulators look at the covered entity first. They expect you to vet your vendors. They expect you to verify safeguards. And they expect you to ensure your vendors sign BAAs and follow secure handling practices. If your vendor is storing patient data in personal email accounts, that's a red flag. And if you never ask them about it, that is a compliance gap. Another issue with consumer email platforms is control. You cannot enforce centralized logging. You cannot guarantee message retention policies. You cannot ensure encryption is configured correctly. You cannot revoke access if an employee leaves unless you control the account. And you cannot demonstrate administrative safeguards during an audit. Auditors and investigators always ask the same question. Show me how you control patient data. If your answer is, it's in staff's Gmail accounts, that is not a defensible answer. Secure communication with patients requires controlled systems. That means organization-managed email environments, secure portals, encrypted messaging platforms, and vendors that are under a contract to protect your data. Compliance is not just about technology, it's about governance and accountability. If you are a healthcare organization, you must know where your patient information is stored, who can access it, how it is protected, and which vendors can touch it. And you must have agreements in place with every one of those vendors. No agreement means no protection, and no protection means liability. So, here is the takeaway. If anyone in your organization is using a personal or free email account to communicate with patients or store patient information, you should treat that as an immediate compliance risk that needs to be corrected. Move patient communication into controlled systems. Verify your vendors. Sign BAAs. Document safeguards. And train your workforce so they understand why this matters. Because the cost of doing it correctly is always lower than the cost of explaining it to regulators why you didn't.